and the local stories you care about. WLBB, Carrollton, News Talk 1330, FM 106.3.
It is now 8:30. Good Tuesday morning, everybody. I'm Colin Worthington in the News Talk 1330, FM 106.3 Newsroom. This is the Community Voice program brought to you by Tanner Health System and Oak Mountain Academy. It's our Tuesdays with Tanner program as we discuss the coronavirus here locally. We're also streaming live on the News Talk 1330 WLBB Facebook page if you want to check out the program that way. And if you'd like to post some questions up there through this program, I'll try and take a look at those and pass them along to our guest this morning, assuming they are relevant and something that they are able to answer. Our guest this morning, Greg Schulenburg, he's Senior Vice President and Chief Information Officer with Tanner Health System. Also, I believe on the line, hopefully this morning, we have Melissa Robertson. She's an RN and Tanner's Assistant Chief Nursing Officer. Good morning, Greg and Missy.
Good morning.
Hey, we got you. Good deal. I tell you, we've had some issues on our side this morning and had an issue getting both of you guys on the program, but I'm glad that it did work out and we're able to talk to both of you. The big news story out of Tanner yesterday is the process of removing tents from hospital campuses. Tell us a little bit about that.
Sure. This is Greg, obviously. So we put the tents up to handle a surge and to process those patients that could possibly show up to the hospital during this pandemic. We practiced in those tents, but we were able to handle all of our patients at Tanner through the facilities, which would be our preference. Having, I think, hit our highest numbers and seeing fewer numbers now, it is time to take the tents down. I think the good news here is we could, if needed, either in the near future or in the future at all, we could reconstruct those tents very quickly and be ready for any patient needs. But it is time for them to come down, and we're looking forward to that.
Absolutely. How close did you, or I guess how much were they put to use, considering what you guys were possibly expecting and preparing for? How much use did those tents get?
We did use them, if for no other reason, to practice in them so that we could ensure they had the right equipment, the PCs, the clinical functions, and we understood how to process patients. So we did use them in two of our locations, actually in all of the locations, but sparingly. And as I said, it was our preference to use the facility if we could, and we were able to do that, which I think really goes to preparedness more than anything. And we were happy to have them in case we needed them, but we used them, sparingly, I would say.
It's a positive image to see those the tents being taken down. How positive should people feel when they look at that? How comfortable should they feel about the treatment of the virus here locally when they see the tents are coming down?
I think what we discovered is through our normal workflows to manage surges in volumes that we are able to appropriately route patients that have screened positive for potential for having a contagious illness away from those who we would say don't present with contagious symptoms, and we're able to use alternative spaces within our EDs and manage population flows so that we can take care of people safely. So we think we had good practice of surge capacity and super surge capacity. Our ED is really good at that kind of process flow, but we feel very comfortable that we can safely provide care for our community without putting them at risk and ensuring that they get the emergent care they need.
Is that should that be an example that the numbers are coming down as far as the patients being treated, people needing to seek hospital treatment?
We are seeing a stabilization and a gradual decline in the number of positive tests we have. Mm-hmm. We did take a stance of aggressive testing in our population because we do know that we have some with very mild symptoms more than 80% of the patients who are positive are really staying home and not requiring hospitalization. But we do hope that with the opening of services that our community is using the appropriate guidance to help us remain safe and stable.
The shelter in place for the state is expected to expire at this point. It's slated to expire at the end of this week. What will the hospital be watching for at that point?
We would look for any increase in the number or percent of positive tests in our community.
Have you had to turn anybody down or say we don't have tests to give you at all? Has there been a point where there weren't enough tests?
We've been able to test fairly aggressively, and we think Dr. Larson is our infectious disease leader, and we believe that if we can test aggressively people who have present with symptoms, even the atypical presenters, and that gives us a better sense of what the impact in our community is, which is why you may see pretty strong numbers in Carroll County early on. But we've been able to manage the volumes that we've seen through some very aggressive strategies with our leadership team to be sure we have the testing we need to manage the community's needs.
Melissa Robertson is RN, is Tanner's Assistant Chief Nursing Officer, and Greg Schulenburg, Senior Vice President and CIO for Tanner Health System, our guests on this morning's Community Voice program. I believe this is our sixth in the series that we've kind of dubbed as Tanner Tuesdays, giving us an update on the treatment and the spread of the coronavirus in West Georgia. You guys have also experienced a backlog of surgical procedures, and the suggestion is that some of them have become urgent. Talks are underway now to begin surgical procedures within the next 2 weeks.
Yes, we're preparing for those surgical procedures. The truth is we've seen patients besides the COVID patients all along, so emergent patients, those in need of surgical procedures, those that are having babies, that sort of thing. So we've been doing that work all along, but we certainly have had patients that needs have gone from, I would say, elective to urgent, and having the clinicians prioritize those and provide those surgical services now, and that'll only ramp up in the future. But doing that work as we've done all along safely and ensuring those patients have a good experience while they're here.
8:37. Before we do take our first break, I'd love to talk about the staff and employees with the hospital and perhaps how their maybe emotions, have they changed in the last week? I mean, do they seem that they're feeling more positive about this? Maybe seeing a point where they can, have a little break and take that breath. Since things are slowing down, are we noticing a change inside the hospital among the workers?
I think so. We've a great group of professionals here that did a lot of work long before this pandemic to prepare for a pandemic. So when the time came, they responded very well, and everyone worked in concert to take care of patients in the best way. Over the last couple of weeks, we have been able to allow some rest for those caregivers and the support staff, with understanding that that they have to keep an eye on the work they're doing, and I think everybody's done that really well. But the numbers are encouraging, and I would say we're cautiously optimistic as we move through these numbers, and as we continue to see them come down. We are seeing people that I would say can rest a bit and take a deep breath, but keeping an eye on these patients is our first job.
How many patients are in Tanner hospitals now due to COVID virus symptoms?
I think we have over 20 confirmed in Carrollton and 10 or 11 in Villa Rica. We're just getting our numbers in this morning, so that may shift a bit. And then we have what we call people under investigation that we are testing because their symptoms mimic the virus of course, that looks like flu and pneumonia would during this season as well. So we just guard those closely, but we cohort those patients so that they're all in a particular area with appropriate isolation.
And what are those symptoms? I guess what is the level where you decide that they are serious enough to have them hospitalized? What
we've learned more about this virus is that it can be fairly broad. So initially the symptoms were a temperature greater than 100.4, a new onset of cough, and a new onset of shortness of breath. But we've seen some atypical presenters. There is myalgias or muscle aches. Some have GI upset. Some have just a profound fatigue. So it really kind of mimics flu symptoms. And so that makes us very cautious when we get anybody in with fever or any of those other symptoms. We sort of isolate them early, test them early so we can rule out.
What are some newer symptoms for people coming in? We've seen them change. I think the CDC even added a couple that had been discussed.
Yeah, that is the muscle aches, the fatigue, and just the GI symptoms have been added.
Melissa Robertson, she's a registered nurse, Tanner's Assistant Chief Nursing Officer, and Greg Schulenburg, Senior Vice President and Chief Information Officer with Tanner Health System, our guest on this morning's WLBB Community Voice program. Time right now is 8:41. We'll take our first break and come back and discuss the coronavirus treatments locally. And I'm getting some positive news out of this. I guess, I don't want to feel too confident that, I don't want to encourage people to avoid social distancing, and if they didn't want to go out and do things this week, despite the fact that some things have been lifted, I don't want to encourage them. Am I wrong in that by saying, hey, still be a little cautious?
No, that's
we want
that's
them
the
to
right
be
message.
Cautious. Yeah. We just want people to be cautious, continue to practice distancing, continue with persistent hand hygiene and awareness of their environment. I think that's crucial as we move forward.
Okay, I've teased this break for the last 5 minutes, so let me actually take it right now. At 8:42, Community Voice, brought to you by Tanner Health System and Oak Mountain Academy. News Talk 1330, FM 106.3, also streaming live this morning on the News Talk 1330 WLBB Facebook page.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
We know COVID-19 has made everything harder, including getting medical care. At Tanner, we've expanded your options to make sure you can get the medical care you trust. Tanner's Care Your Way gives you telemedicine visits for general and behavioral health, walk-in care at our urgent care clinics, and appointments at our emergency departments. Let's get better together with Tanner's Care Your Way. Visit tanner.org/careyourway to learn more. That's tanner.org/careyourway.
(8:43). Welcome back to the WLBB Community Voice program, News Talk 1330, FM 106.3, also streaming live online, newstalk1330.com, and on the News Talk 1330 WLBB Facebook page. If you are tuning in on the Facebook page this morning, I'll try and look at the comments and questions to see if we can pass anything along to our guests this morning, who are Greg Schulenburg, Senior Vice President and Chief Information Officer, Tanner Health System, and Melissa Robertson. She's an RN, Tanner's Assistant Chief Nursing Officer. Again, appreciate them checking in with us on this Tuesday as we talk about the treatments and cutting down the spread of the coronavirus here in West Georgia, also in East Alabama. I'm going to go back and touch on something that I know you guys have talked about several times, and you've shared it on your website when it comes to the numbers that you treat over the last several weeks. Again, the numbers you're providing are coming out of Tanner hospitals, at least 3 locations, right? 4 locations. And some people are having some confusion as far as the numbers they're getting from the Department of Health as well. Can you differentiate those numbers for us one more time?
Sure. We report those tests that we do directly as part of Tanner Health System. But the department, there are patients who get tested through other entities, and we don't have access to those. So we would only be able to provide the information around those that we provide testing for. So that's where you're going to see the differentiation between the Department of Health's numbers.
What's the longest a patient's been treated for COVID in Tanner Hospital?
I think we had some that were very critically ill, that had a lot of what we call comorbid conditions before they got sick with the COVID-19 infection, and those were upwards of 20 to 30 days. But again, they were already very debilitated, which makes recovery and the acuity of illness more accelerated than you see in the general, more healthy population.
What does the treatment involve?
We're using some of the newer modalities that you see on the CDC. Certainly, we've heard it talked about as part of the political scene, the Plaquenil, and just symptomatic treatment, which is similar to what we do for flu. So some of the impact of the infection is that we have systems and organs that fail as part of a response to the infection. So supportive care, ventilator care, continuous dialysis therapy, managing blood pressure through use of IV medications, those kind of things to support the body as it recovers.
I've read some things, and please clarify if they are incorrect. As far as long-term damage that can be done to your body because somebody did contract the virus, are there issues to be worried about? Like you say, you get through it for 2 weeks and you think you're fine, but are there long-term issues to look out for?
There's always that risk anytime you have organ failure associated with any infection. We know that there can be damage caused through inflammation as the body is impacted by the infection. So it just remains to be seen. We have seen similar things when we deal with flu and pneumonias. So we'll just have to look behind us once we get through this pandemic to see what the overall impact is for those that have been critically unwell.
Were there hospital employees that maybe their positions were used less because of the COVID virus? Things that you think about, surgeries were less, things along those lines. Were there hospital workers that were able to step in and do other jobs and take care of some other things? Maybe, I don't know, it's even cleaning, keeping things clean and keeping everybody separated properly. Were there roles people stepped up and did other roles?
Yeah, I think that's a great way to put it. Obviously, the first goal was to ensure we had the clinicians providing the care and the support staff for those clinicians. But we've had people or staff members doing jobs now that they weren't doing 2 months ago, job sharing, depending on the need. Of course, cleaning and disinfecting is a big part of pandemic preparedness and process. So we have a lot more, I would say, staff cleaning and ensuring that rooms are disinfected and testing those rooms after they're disinfecting. So you said it well. We've had a change in job roles around the hospital, but I've been very proud of the way everyone stepped up to the need, regardless of the role, and just picked up the people around them and helped them all the way through this.
Sure. We've also had folks that have done screening at our entrances that were open. And have folks that are calling families to update them about patients' status and providing testing information and results. There's lots of different roles made for work for folks that may not have been working actively in their own department.
Melissa, what was an average day for you once this really hit its peak locally compared to even today? It may still be the same, but what was an average day for you?
I think the greatest challenge has been that this has been such a fluid situation. We are accustomed to setting standards and protocols in place and rolling them forward, and everybody having a clear perspective about what's next. But because this is such a new virus, that we had to really be very facile in changing as the guidance changed. And the most important thing, I think all of us in the leadership role have been doing, is being sure we're open and communicating with staff, answering questions, and assuring them that we're giving them the information they need in a timely manner. That seems to be the most critical thing we do, is to communicate and to be available to answer questions and concerns as they arise.
And I imagine that's the same with you, Greg, as Senior VP. Communication was probably one of your. I mean, it's a big role for you anyway, but I imagine that went up a little bit over the last several weeks.
Yes, and making sure everyone has the right message, whether that's procedural or clinical or whatever, has been a big part of it. We have a command center that centralizes a lot of that communication. But there's also, I would say a lot of work every day around those patients that don't have COVID, and making sure the hospital is essentially a hospital within the hospital to handle those patients as well and keep them safe. And we've done, I think, really well there in ensuring and emotionally helping those patients that come into the hospital for other services. So, as Missy said, it's a fluid process. The day changes. There are some things that we do every day, like listen to the clinical procedures and understand and listen to the clinicians as to how they're changing care, but also a lot of logistics work that goes on just to make sure that supplies are in the right place, the patients are being moved in the right areas, that surgeries and babies being born and all of those great services are still happening, and they're happening in the safest way. And that's what I want to keep saying, is that all patients are being handled here, and they're being handled in the safe and best way.
As far as babies being born, I imagine the numbers aren't that far off from what they were last year at this time. You guys still had to deal with that.
Yes, that's one thing you just can't put off when the time comes. So I think that those things have been consistent. And our maternity service has really done a lot of work around being sure that we are safe in this process, that we're screening effectively, that we do have plans if there is someone at risk, and how we keep everybody safe in that environment. They've done drills, they've walked through processes, and they're current with the most up-to-date information through CDC and through their governing bodies as well. So really, I think it's been very good.
In talking to people, I've heard this joke, some form of it, put out there probably about 10 times in the last 2 or 3 weeks, but December and January could be a baby boom in Carroll County.
Absolutely. We hope so.
It's 8:53. We're going to take our final break here and wrap up our program and give our guest this morning the opportunity to tell us what to look out for over the next couple of weeks, and maybe just give us a overall summary of now that they take this big step, now that they are making efforts to return back to normal in some way. We'll do that after our final break here. 8:53, Community Voice, brought to you by Tanner Health System, Oak Mountain Academy on News Talk 1330 FM 106.3.
We know COVID-19 has made everything harder, including getting medical care. At Tanner, we've expanded your options to make sure you can get the medical care you trust. Tanner's Care Your Way gives you telemedicine visits for general and behavioral health, walk-in care at our urgent care clinics, and appointments at our emergency departments. Let's get better together with Tanner's Care Your Way. Visit tanner.org/careyourway to learn more. That's tanner.org/careyourway.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
854 Community Voice, News Talk 1330, FM 106.3. Streaming live on the News Talk 1330 Facebook page this morning. And I'm your host, Colin Worthington. Our guest, Greg Schulenburg, Senior Vice President and Chief Information Officer with Tanner Health System. And Melissa Robertson, registered nurse. She's Tanner's Assistant Chief Nursing Officer. We've got about 5 minutes left in the program. What kind of advice, words of wisdom, reflection can you leave us with?
I think we all want to say we're here to take care of you as our community, so don't be afraid to come to us and seek the care that you need. We have everything in place to keep you safe, and we are glad to take care of you.
And how about you, Greg?
Yeah, the same, really. We're here to take care of patients regardless of why the patient's here, so diagnostic tests, surgery, whatever, and we've, of course, talked about the deliveries, but we're here to help and to take care of the patients of West Georgia and East Alabama, and we're open and ready to do that, and really, other than that, just pay attention to all the safety precautions that are out there now around the pandemic and continue to practice those and use the abundance of caution, as we say.
And wash your hands.
We, with about 4 minutes left in the program, I saw a lot of people stepping up, whether they were providing meals or getting you guys access to meals, people building masks and donating gloves as well, I assume. How about that community response? Are you seeing that nationwide when you compare the local response? Is it comparative, maybe even better than what you're seeing and talking to your friends elsewhere, maybe?
Yeah, it would be, from my perspective, it would be hard to imagine it being any better than we've seen it in West Georgia. I mean, from constructing masks, actually making the mask and donating those, all of just food services for those that are providing care, kind of 24/7 food services. We've even had, kind of specialty and science people looking at hand sanitizer and how they could provide that or make that or send that to us. Local industry that have access to masks and the like doing the same. And then just general support, calling and asking how, volunteers can help. It's just been, I would say, overwhelming, but just unbelievable how the community stepped up to this, and hopefully Tanner's done the same for others in the community providing care in some way.
8:57. I guess we'll wrap up the program on that note, guys. Thank you for checking in with us one more time. I think this was the 5th or 6th time we've done this, and we're going to do it at least one more time next Tuesday. We'll hopefully be able to talk about have a look at the current situation. We'll do that next week, and if we need to keep doing it after that, we will keep doing it. So I do appreciate you guys participating and helping us, or allowing us to help you get the word out about the virus here locally. Again, thanks for checking in this morning. Greg Schulenburg and Melissa Robertson with Tanner. Time right now is 8:58. You'll want to stay tuned for national headlines coming up in about 2 minutes. Then I'll have local news at 2 minutes after the hour, and Glenn Beck is on the air, followed by Rush Limbaugh and Sean Hannity on News Talk 1330, FM 106.3. Have a great Tuesday, everybody.